The precise nature of the relationship between anxiety and performance has long been a topic of interest amongst researchers and athletes alike. And a number of theories have been proposed, from the idea that a moderate amount of arousal is best, known as the inverted U hypothesis, to the observation that each of us has a unique individually optimal range of activation, known as the individual zones of optimal functioning model, to the concept of anxiety having both a mental and physical aspect, each of which affects performance differently, known as multidimensional anxiety theory. Indeed, part of what makes this tricky to nail down is that anxiety can affect us, and in turn our performances, in a multitude of ways. There's the physical aspect of anxiety, of course, and it's not much fun when your heart starts pounding through your chest and your hands turn sweaty yet ice cold at the same time. However, as uncomfortable as this may be, our mental response can be even more detrimental to our performance. How so? Well, it turns out there are a couple key ways in which our mind can cause our performances to fall apart. Distraction theories suggest that under pressure, our focus goes away from the music to irrelevant thoughts, like worrying about what others in the room might be thinking about our playing, and all sorts of creative worst-case scenarios. But since our brain can only think about so much at once, both the relevant and irrelevant thoughts end up competing for the same limited attentional resources, and something has to give. For instance, I've heard many musicians admit to having concerns about memory in solo Bach because of the potential for taking a wrong turn or getting stuck in one of those memory cul-de-sacs, where you can't quite figure out how to get out of the loop. The great irony, of course, is that the more we worry about having a memory slip, the more likely we are to have one, because these worries prevent us from thinking about our memory cues and staying in the moment. Explicit monitoring theories, on the other hand, suggest that under pressure, our attention shifts to the physical execution of motor movements, and we try to micromanage all the individual steps instead of trusting our muscle memory to take care of the job. The problem is that once a skill becomes automatic, thinking about what exactly your thumb, elbow, wrist, and fingers should be doing at each moment of a tricky shift totally screws up your ability to execute what should be a fluid, effortless motion. And if you've ever been set up on a blind date and told to just be yourself, you know how difficult a task it is to stop overthinking everything when you're completely self-conscious and don't remember how to act like a normal person or play something you've nailed hundreds of times before in the practice room. So, in a nutshell, distraction theories suggest that we choke under pressure when our attention goes away from the music to unrelated and often anxiety-increasing thoughts, while explicit monitoring theories suggest that we screw up because our attention goes towards the mechanics of the task, rather than to the musical end goal, like the sound or phrasing we wish to achieve. So what are we supposed to think about? One factor that seems to differentiate the best performers from the rest is something known as quiet eye. Previous studies have observed that expert performers' eyes tend to be less active in the last few moments before executing a skill. A basketball player, for instance, might focus on the hoop before shooting a free throw, or a golfer might gaze at the ball before teeing off. Which sounds like a perfectly reasonable thing to do, except that when we're nervous, all this tends to go out the window. We get frazzled, a million different thoughts race through our mind, our eyes dart around the room, and we dive right into a piece without even taking a moment to remind ourselves what kind of sound we want or what the tempo ought to be. Eye movements may not sound like a big deal, but it seems that our eyes are indicative of our focus, that where we look and how long we do so can give us a sense of how effectively we are using our attentional resources under pressure. Are we glancing out at the audience and worrying about what they might be thinking? Or looking blankly at the stage, furiously trying to remember how the second line goes? Expert performances seem to go hand in hand with longer pre-performance quiet eye moments of silence, and it also appears that performing optimally requires that our brain gets itself organized before initiating movement, because quiet eye periods get longer as skills become more complex. In other words, the best performers don't just cross their fingers, hope for the best, and wing it. They actually take a moment to slow everything down mentally and prepare themselves to execute a movement before doing so. A team of British and Canadian researchers recently studied the effect of quiet eye training on a group of first-year surgery residents. After taking a baseline test of their surgical knot tying skills, some of the residents received quiet eye training, which taught them to focus their gaze on the precise location of the knot before making each loop. The others simply received additional technical instruction. After going through the training and engaging in more practice repetitions, the residents were tested on their knot-tying skills in both low-stress and high-stress situations to see how well their skills would hold up under pressure. In the low-anxiety test, they were told that the test would be used for calibration purposes, and they wouldn't be compared with any of the other surgical residents. So sure, it was a test, but there wasn't really anything at stake. In the high-anxiety test, they were told that their performance would be videotaped, their teachers would be evaluating their performance, and they would be ranked among their peers. And to add even more pressure, everyone was told that their performance so far was in the bottom 25%. So nobody's life was at stake, but unless you want to look bad in front of your teachers and peers, you best not screw this up. So long as there was nothing at stake, both groups performed pretty well. Under pressure, however, it was a very different story. Once the nerves kicked in, the residents who received only technical instruction saw their performance regress back near baseline levels, almost as if they hadn't received any training at all. Meanwhile, the residents who received quiet eye training continued to perform at a high level. At first glance, you might wonder how this strategy could possibly relate to music performance. And indeed, it's no help to stare at your stand while you think about all the things that could go wrong or make dinner plans in your head. I think the key principle behind quiet eye is the slowing down and quieting of your thoughts, where you preempt the distractions and worries by focusing on what's most important in the last few moments before you play. Like hearing the opening phrase in your head before you begin, reminding yourself what character and mood you're trying to communicate, or even recalling the kinesthetic feeling of playing the first note.